Hello and welcome. Today, we're diving deep into a rare and fascinating neurological disorder known as Whipple's disease. While not exclusively a nervous system disease, its impact on the brain and nerves can be significant. Join us as we explore its causes, symptoms, diagnosis, and treatment. Whipple's disease is caused by a bacterium called Trophorema whipplei. This bacteria is relatively common, but only a small percentage of people who are exposed to it actually develop the disease. It's believed that individuals who develop Whipple's may have a weakened immune system that allows the bacteria to flourish and cause widespread infection. The pathophysiology of Whipple's disease is complex. Trophorema whipplei primarily infects the small intestine, disrupting the normal absorption of nutrients. This leads to malabsorption and subsequent nutritional deficiencies. The bacteria then spreads to other organs throughout the body via the lymphatic system and bloodstream, including the brain and other parts of the nervous system. In the brain, the bacteria can cause inflammation and damage, leading to various neurological symptoms. Whipple's disease is incredibly rare, affecting an estimated 1 in a million people. It's more commonly diagnosed in men than women, with most cases occurring between the ages of 40 and 60. While it can affect people of all ethnic backgrounds, some studies suggest a slightly higher prevalence in individuals of Caucasian descent. Due to its rarity, obtaining exact epidemiological data is challenging. The symptoms of Whipple's disease are diverse and often non-specific, which can make diagnosis difficult. Common symptoms include diarrhea, abdominal pain, weight loss, and joint pain. However, when the nervous system is involved, patients may experience a range of neurological problems, such as difficulty with coordination, memory problems, seizures, vision disturbances, and even personality changes. Muscle weakness and involuntary eye movements are also possible. The variability of these symptoms often leads to delayed diagnosis. Diagnosing Whipple's disease typically involves a combination of clinical evaluation, laboratory tests, and imaging studies. A small bowel biopsy is crucial for confirming the diagnosis. The biopsy sample is examined under a microscope for the presence of Trophorema whipplei bacteria. A PCR test, which detects the bacteria's DNA, is also commonly performed on the biopsy sample. Neurological symptoms might warrant an MRI of the brain to look for signs of inflammation or damage. Because the symptoms are often vague, a high degree of suspicion is required to consider the diagnosis of Whipple's disease. While there are no distinct subtypes or classifications of Whipple's disease, it can be categorized based on the extent of organ involvement. Some patients may primarily experience gastrointestinal symptoms, while others may have predominantly neurological manifestations. Still, others have a combination of both. Neurological involvement significantly impacts the treatment approach and prognosis. The primary treatment for Whipple's disease involves long-term antibiotic therapy. Initially, intravenous antibiotics, such as ceftriaxone or penicillin, are administered for several weeks. This is followed by a prolonged course of oral antibiotics, typically trimethoprim, sulfamethoxazole, for up to a year or longer. Regular monitoring is essential to ensure the bacteria are eradicated and to detect any relapse. Neurological symptoms may require additional supportive care, such as physical therapy or medications to manage seizures or other neurological complications. There is currently no known way to prevent Whipple's disease, largely because we don't fully understand how people become infected with Trophorema whipplei in the first place. Practicing good hygiene is always important, but it's not clear if this directly reduces the risk of developing the disease. The prognosis for Whipple's disease has significantly improved with the advent of effective antibiotic therapy. Early diagnosis and prompt treatment can lead to a full recovery. However, delayed diagnosis or inadequate treatment can result in permanent neurological damage and even death. Relapses can occur even after successful treatment, so long-term follow-up is crucial. Recent research has focused on improving diagnostic techniques, identifying biomarkers for disease activity, and developing new antibiotic regimens to combat relapses and antibiotic resistance. Studies are also investigating the role of the immune system in the development of Whipple's disease, which may lead to new therapeutic strategies in the future.